New technologies in assisting infertility today. Before exploring the technology that assists in fertility, we will look at the meaning of infertility first. The meaning of infertility is defined by the National Infertility Association as the inability to conceive after 1 year of unprotected intercourse, or 6 months if the woman is over age, also by the inability to carry a pregnancy to live birth. Some quick facts about infertility. 7.4 million women, or 11.9% of women, have ever received any infertility services in their lifetime. 1 in 8 couples, or 12% of married women, have trouble getting pregnant or sustaining a pregnancy. And approximately 1/3 of infertility is attributed to the female partner, 1/3 attributed to the male partner, and 1/3 is caused by a combination of problems in both partners or is unexplained. The first topic I will be talking about is women and infertility. Some causes of infertility in women are caused by problems with ovulation. Without ovulation, there are no eggs to be fertilized. And some signs that a woman is not ovulating normally include irregular or absent menstrual periods. Also, there are risks that could increase the chances of infertility, such as a woman's age, smoking, excess use of alcohol, stress, a poor diet, too much athletic training, being overweight or underweight, and also sexually transmitted infections. The first modern technological treatment I will be discussing is intrafertilization. During intrafertilization, embryos are transferred into a woman's body in the hope that at least one will survive the implant into the uterus and result in a successful pregnancy. And now, using CCS, doctors are able to know which embryos are healthy. This brings us into our next technological treatment, which is comprehensive chromosomal screening. During the CCS process, a biopsy sample is taken from the embryo and then undergoes a computer analysis to identify any abnormalities. Once a healthy embryo is found, doctors can be more confident that the IVF will work. Plus, with CCS, they are less likely to recommend that moms have more than one embryo transferred, which can result in multiple pregnancy. And that's good because being pregnant with twins or more heightens a mom-to-be's risk of complications and raises her baby's risk of being born prematurely and possibly having health issues. Now, moving on to men and infertility. Now, causes of infertility. More than 90% of male infertility cases are due to low sperm counts, poor sperm quality, or both. The remaining cases of male infertility can be caused by a range of conditions, including anatomical problems, hormonal imbalances, and genetic defects. Some risks that can increase chances of infertility are varicocele, an enlarged varicose vein in the spermatic cord that connects to the testicle. Aging, which can reduce sperm counts and mobility and decrease the genetic quality of sperm. Sexually transmitted disease also increase chances of infertility because they can cause scarring in the male reproductive system or impair sperm function. Lifestyle factors such as smoking and substance abuse and or long-term or intensive exposure to certain types of chemicals, toxins, or medications. Complications that exist in the testes, such as low sperm count, low percentage of sperm movement, or a blockage that could affect the release of sperm, are all reasons as to why doctors have turned to technological advances in sperm retrieval. Some modern technological advances, such as percutaneous epididymis sperm aspiration, It uses a needle to obtain mature sperm from areas in the upper parts of the epididymis, which is the coiled tube where sperm are stored before ejaculation. It is performed under local anesthesia and sometimes in the doctor's office. It is less expensive than other techniques, and the recovery is relatively painless. Now that the sperm has been retrieved, I will move on to an advancement in assisted reproductive technology that was specifically developed to aid couples conceive when male infertility is the main factor. The technology developed is called intracytoplasmic sperm injection. This sperm injection is used in combination with in vitro fertilization. The procedure requires a tiny glass tube called a holding pipette to stabilize the egg, as a second glass tube called the injection pipette is used to penetrate the egg's membrane and deposit a single sperm into the egg. The egg is then released into a drop of cultured medium. If the egg fertilizes, the egg is allowed to develop for 1 to 2 days and is then either frozen or implanted. With advances in technologies that assist infertility, such as those I have discussed, women and men alike have safer and more effective alternatives to reproducing babies of their own instead of having to find donors or surrogate mothers. These procedures not only save time and money, but they give infertile couples a greater opportunity to be parents to children of their own.